while it's still a few weeks until the first phase of vaccinations begin, local health departments are already practicing what it will look like. CBS 17's Colleen Quigley is live. So, Colleen, what are they doing?
Yeah, so actually, Angela, North Carolina DHHS told me that today and tomorrow they're actually working with the CDC and Operation Warp Speed for an end-to-end shipping test run with Pfizer. The county also tells me that they are using some of their flu vaccine sites as a test run for the COVID-19 vaccine distribution.
Once the federal government allocates COVID-19 vaccines to each state, doses will then be divided to each county.
We're prepared for it.
Dr. Jason Wittes, Wake County's pharmacy director, believes that first round of vaccine will be administered within this month to healthcare workers, medical first responders, and staff in long-term care settings.
So we anticipate anywhere from the next 2 to 4 weeks for priority group 1A.
This week, NCDHHS worked with the CDC and Operation Warp Speed for an end-to-end shipping test of the Pfizer vaccine, which requires ultra-cold storage. But Dr. Wittes says for the past 2 months, the county's focused on rolling out the vaccines, even practicing techniques similar to flu vaccinations, which also require refrigeration.
Our plan has the gambit, right? So multiple vaccine candidates on the ground at the same time, multiple vaccine schedules, so 21 days apart, 28 days apart, one dose, all paper. Let's say the power goes out, all paper, so we don't have to stop that day, full digital plan. So our plan is pretty comprehensive.
Wittes says allocation of the vaccine is population-based, and while it's too early to say exactly when it'll be widely available, they're working hard to make sure everyone who wants to be vaccinated will be.
Some of the populations that might be a little bit harder to reach, so homeless, historically marginalized population, incarcerated individuals, making sure that they are all being addressed and getting the vaccine when it's their time to be addressed.
Well, today, the CDC advisory on immunization practices voted who should be included in that priority group 1A. NCDHH is telling me that they're going to look at that and see if, based on those recommendations, they have to make any adjustments to their plan. Reporting live in Raleigh, Colleen Quigley, CBS 17 News.